I've got to keep resisting the temptation to check my email while we're waiting here. I like about the time we go live stream again, I'd be checking it.
I think the rest of us have been doing that already.
At least those of us not sharing our screen.
Amy, is there any way we can just record this and then upload it to YouTube later so we can keep moving here?
Sure. Doctor, if you want to keep going, we will upload the video for the public later, and if we can get the live stream going, great. But I will.
Okay.
I hope that doesn't create any conspiracy theories, but I know Dr. Basil's time is valuable.
Okay, we will. I don't think we're recording right at the moment, but there'll be just a little gap. So go ahead, and when Dwayne can record, he will, and then we'll post it when we have it when we have the meeting to complete.
Okay, go ahead and let me know when you are recording, and maybe I'll recap what I've said here recently. So one other point then I'll go ahead and make about this graph before I leave it is one benefit, I suppose, of Sioux Falls ramping up earlier is that we're likely to peak earlier and start coming down. And so hopefully by the time that Sacred Heart region starts to peak, McKinnon is starting to empty out a little bit and maybe can handle a little bit of the excess capacity if at that point Sacred Heart is getting slammed. So that could be a blessing that we weren't counting on earlier. Our first modeling, we were assuming that the whole state would surge at the same time, and at the same time that Sacred Heart was going to be swamped, McKinnon was going to be swamped here in Sioux Falls, and we couldn't transfer patients around. Now we may be able to actually even use Sacred Heart to offload some of the surge from Sioux Falls and then accept them back the other direction when the later peak hits. And so that may help us avoid some of this asymmetry as well. And so that could actually be a good thing for us. All right, and now this is the other slide that I wanted to spend a little bit of time talking about. A lot of the questions that come into this is, how do you model South Dakota's sparse population, or at least compared to, say, a New York City? And how do you model the effects of social distancing? And if I remember right, Mayor, you can maybe say Yankton even has a little bit more stringent social distancing policy in place in the state as a whole right now. Is that correct?
That is correct, yeah.
And so this is that modeling, how we take that into account. So I said the first model that we did not have any corrections for sparser population and social distancing in it. And that showed more of a peak here kind of happening about a week from now. And we certainly have not been following that trajectory. And that's telling us that you know, the social distancing efforts that we're having are having an effect, and that's that whole flattening the curve concept that everybody always talks about. Try to lower what that peak number is, but it spreads it out over a little bit broader time period and shifts that time period a little bit later in time. And we're seeing that effect happening, and the kind of the estimates of that is nationwide and in other countries. This whole model that we're using was originally developed for influenza and then was used for SARS and MERS over in the Middle East and stuff, and been refined for those sorts of different use cases. And kind of they found that when they do interventions that are kind of encouraging people to stay at home, canceling schools, and a lot of the similar sorts of things that we've been doing in Sioux Falls, that reduces the spread by about 25%. So that's that green line that we're following right now. This is one just happens to be modeled for Sioux Falls that we're showing, that we showed the Sioux Falls city government. If we do a more formal shelter-in-place order, then that can lower it down considerably. And then if we got really militant, you know, practically martial law type of thing, you could almost flatten this out to where there was hardly a peak at all. But I don't think that's palatable, or anybody in the state's going to want to do totally not letting anybody out of the house at all. This is more kind of somewhere between this line and this line, I feel is kind of where the Yankton area is. And so that's one of the reasons why, with this one being on a 25% trajectory for the state, and yes, 10% or so of that would be 150 to 200 beds. I think with that a little bit more aggressive policy that you've had in place in Yankton, that's probably more likely going to be closer down to that 100 bed peak census is my best guess at this point. We're going to get some more specific information out of our PhD epidemiologists later this week, but I'm guessing that's what they're going to tell me is going to be somewhere in that 100 to 125 beds, which is a lot more palatable in the Sacred Heart area because of the fact that you are being a little bit more aggressive than the rest of the state, meaning that we're going to follow a lower peak with maybe a little bit broader. And so that'll be very helpful. The other thing that I will bring up is that this is, again, back to a Sioux Falls modeling, but about 30% of the bed total ends up being ICU beds. And so if we look at around 100 to 150 beds at Sacred Heart, that would mean about 30, 35 beds would be ICU beds for Sacred Heart region, maybe 40 at the upper limit at the peak census, which again is going to be numbers, Doug, you could jump in here, that I think we haven't seen at Sacred Heart, at least not for many a year, but they're not something that would be totally out of the realm of doable type of thing. I don't know if anybody wanted to comment on that. So.
Yeah, Dave, this is Doug Ekron. I would agree with you. Those are certainly much higher, both overall patient and intensive care patients, and with a fair number of those ICU patients also requiring ventilators. We do have plans in place that we think we could care for up to 170 people on campus, give or take a few either way. The biggest challenge for us will not be where do we put people, it is the staff to take care of people. And so that is a significant piece of our preparation as we look at these numbers. And I do like the sound of 100 to 125, much better than 170 patients, but having the staff to take care of them, having physicians, nurses, and others, and then having the personal protective equipment that all of those folks need to be able to safely take care of those patients who come to the hospital needing us. So that's really where a lot of our focus is right now, along with working with other facilities in our region, because we know some of the smaller hospitals aren't able to keep the sickest of the sick kinds of patients. But given the physician expertise and the telemedicine services that we'll have available here, we expect a fair number of those patients to be transferred into us, especially if there is overlap with peak census periods in Sioux Falls. So the good news that Sioux Falls' peak might be a little earlier really will help us provide that higher level of care to more people here and have that backup available.
And another point that I'll make here as well from that staffing standpoint is we've got to remember that not only are we trying to staff more beds with the people that we have, in reality, we're expecting that because healthcare workers are exposed so much, we're likely to have 10, 20, even 30% of the staff may be out at a given time because they've had an exposure and are symptomatic, even if it's a mild level of symptoms, that we can't have them exposing other patients. And so we may be down from staff from our usual numbers, even though we are cross-training, other staff to come into the hospital standpoint and stuff like that. But that is a concern as well, as we may actually have fewer staff than normal.
Just a question, based on your analysis and hearing what you have heard about what Yankton's doing, what other communities are doing, I would like your opinion, doctor, on when you think what conditions do you think need to be met before the city commission or the health board starts to lift any of the regulations that are in place. What does that look, what would that look like where we could start backing off a little bit, knowing that we have some political pressure when we talk about our ordinance as well?
And first off, let me say, I absolutely understand the other side of this equation. I grew up on a farm. I totally understand, small businesses and the fact that you've got to get things to market. You got to keep workers working, and that side of the equation, I totally understand. And so that's a very valid question that we think about on a daily basis right now too. When can we get things open back up? When can we get people to work? Heck, when can I go to a restaurant again? I'm tired of eating my own cooking. And so that's a very valid question. One of the nice things about us peaking a little bit later is we're also going to learn, about efforts in other part of the country that are already starting to peak right now, and they're going to start coming back down, and we're going to start trying to open things back up here later on in May, because we're going to learn from them as they open up. Do they have a resurgence, a double hump? How effective are their efforts to do that? So we're going to learn a lot as we go along. What I would say is that in most of the data that I'm seeing out there is saying you want to see a good probably 2 weeks of this downhill numbers convincing you that you're coming down on the back side of this, and so that numbers are declining. So that's first place. You've got to be pretty confident that you're over the top peak of the surge. Two, you've got to look at your supply chain things. Are we able to have enough personal protective equipment in place and things that if we do have a second hump when we try to open things up, that we've got enough supplies to handle that? Three, do we still have enough staff that aren't out sick and that are still able to care for people if we do have another second surge coming in? Those are probably the major things that we're able to do that. And then you do it in a staged fashion. And so probably the last things we're going to open up are like nursing homes to visitors and things, because they're the most vulnerable population that we have. So probably the first things is expanding the list of essential businesses and start adding on, more and more pieces to that as we open it up in stages would be my recommendation, rather than opening the spigot wide. Let's say, okay, before we didn't allow say, I don't know, construction workers. Now we're going to allow construction to start back up. Now we're going to allow beauty salons to open back up, and kind of do it in a staged fashion so that we can have some checkpoints in there little by little to make sure we haven't gone too quickly. And then as you go, we'll have learned other cities across the nation how their efforts have done and whether that's backslid or not. And so that's kind of the things that we're looking at as far as our recommendations of when it looks like it's time to open back up again.
So currently Yankton County has 3 active cases, 23 total that we've had, 20 are recovered. We haven't seen a lot of movement, I would say, in the last week at least. And so with that, coupled with what we're hearing at the national level, with the president wanting to reopen America on May 1st, I'm concerned that a lot of people are thinking we're through this and we can start loosening things up.
Yeah, we're in this flat part of the curve right here. I mean, that's the problem, is we're in this flat part of the curve right here. We're not going to know until about that second week of May if we're starting to follow this trajectory up here. And that's one of the things we're going to have to watch, because if all of a sudden we start following more of a curve like this for the state, saying that, our spread distance and stuff and the efforts we're having is keeping this number down here, that's going to be a whole different story than if we do continue to follow this trajectory up. I can tell you in the Sioux Falls area, when we just model Sioux Falls, we are following this trajectory, this green line for Sioux Falls, pretty much exact on a week-by-week basis. And this is kind of a critical week for us in Sioux Falls, because we're about right here right now. If we do go ahead and double another week in Sioux Falls, that'll definitely tell us this is the trajectory that we're on for Sioux Falls. And so we're watching in Sioux Falls really closely this week. This will be a really important week, this one and next one, to tell us if we're going on this trajectory. Unfortunately, we're a couple more weeks out from being able to have that clear of an indication for the rest of the state, including Yankton and surrounding regions. And again, this is a model, and the model is just as useful as the data you put in, and we'll have to adjust as we go. This is what, you know, the PhD epidemiologists and the best scientists I can come up with are telling us right now. But I understand I'm getting sick of being at home, especially, you know, when there's not a lot of cases and stuff like that. I get it. I definitely get it. But the problem is, we open up now and we start coming. It takes, you know, we're piloting the Titanic here. We're not piloting, you know, a little speed craft. You know, let's say we decided to open up here and it started going like this all of a sudden. We tried to shut it down here. It would be until that started having an effect. And so it takes a while for any change in public policy to show that effect. And so you can't just, well, let's turn it off for a week and see what happens. You know, it would be 2 or 3 weeks, and then it's been festering underneath there so long before you find it that it spikes up, and then it's too late to get that spike under control as part of the problem.
Yep. And then I guess my other question would be regarding testing. I think we've got better testing capabilities than what we've had, but there's still definitely limitations, and it's not rapid and it's not widespread. How much do you have a feel for how many cases we might be out there that we don't know about because of the limitations in testing, and how soon can we expect that situation to improve?
Yeah, this modeling that we've done kind of assumes that we catch about 10% of the cases out there. So we're assuming there's about 9 cases out there that are either totally asymptomatic, person has no symptoms at all. That's about half. And then the other half are patients that have mild symptom and we don't test. And so we do assume it's about 10% of the cases are what we test positive for. And so it's about a 10-to-1 ratio is assumed in here. And that's one of the reasons why social distancing is so important. You feel just fine. You think, you know, I don't have it, but you're walking around and maybe you're a carrier and spreading it without even knowing it. That's one of the problems with here, is that there's that relatively big thing that people don't know they have it.
I've seen anywhere from 60 to 80% are asymptomatic. Where is that number landing right now?
Our models are assuming about 50% are asymptomatic, and another 40% are minimally symptomatic or low symptomatic is kind of what our, you know, assumptions have been.
So when I look at this model too, I see this critical week for Sioux Falls, but also a critical sort of 2 weeks, 2 and 3 weeks for us to determine, are we going to start moving up, or are we going to continue sort of flattening and extending? So I guess there's a couple schools of thought, but Doug, from the hospital side, are you able to give any indication of where you are as being prepared with staff and supply chains and those sort of other elements that the doctor mentioned that don't have really to do with cases, but have to do with more our preparedness?
Yeah, we do a lot of work on the staffing models and the labor pools and reassigning staff. As I think you're all aware, we have a number of services that are closed currently, and that allows us to reassign staff for a variety of ways. But if we're literally going to go from a census in the 30s to maybe 4 times that, we're going to need significantly more resources. And so we have been talking with other entities about staffing. We also want to use technology as much as we can from a telemedicine perspective. So while I would say we're okay on that, and we're much more okay at 125 than we are at 170, but we're also looking at other potential needs. That what happens if we need more beds than the 170 that we think we can do on our campus, and we're focused on our campus because we've got things like pharmacy and nutrition and other services available on the campus if they're needed, as opposed to as soon as you go off site to have to set up another remote location then you've got to figure out how you provide all of those services. And so we've tried to look to maximize beds on this campus. On the supply side, we're in good shape today, but what we learned from our counterparts around the country is that when this hits, it typically hits pretty fast, and you go through a lot more supplies than what you had planned on. So I think we would be okay, at least now, if we continue to get supplies that we have ordered. And we all know there's all this ramping up taking place across the country. And a lot will depend, I think, just on what else is happening in the U.S. at the time that we have our surge here, and how that impacts supplies that we have ordered and that we need compared to what may be major metropolitan areas that have much higher numbers of cases and what's happening there. So I would say right now we're okay, both from the staffing and the supply side. We just have to see when the surge comes and how significant that is all at one time. So the other thing that I would say that we have an advantage with being part of a health system, if we're having a surge here, but Aberdeen isn't, or McKinnon isn't in Sioux Falls, we can also adjust supplies around to where the demand is. And so obviously that's not a factor if all of us are getting hit at the same time with a surge, but since typically we're seeing things are at maybe a different pace at different communities, so that gives us a little more leverage on the supply side and potentially staffing as well.
So I guess what I'm hearing is we're not on track to be Italy here, fortunately, because we've taken a lot of measures to educate people on the need for social distancing. But the track we are on will still stress our healthcare systems. And we've got a little bit of a marathon ahead of us. It's not just a week. We need to keep people doing this for weeks, a month yet, more or less, at least. And that's going to be a challenge as the weather keeps getting nicer and people look to the coast and see maybe things are starting to open up a little bit there, and they're on the backside. So it's just a really complicated situation. I keep calling it a social experiment. And, some people are better at following advice and recommendations than others, as we've seen, and that will continue to be our challenge. Are there any other? Go ahead, Dr. Basil.
I was just going to say, I think I agree with that entire assessment.
Are there any more questions for our participants? If not, I would just like to thank Dr. Basil and Doug for joining us today and providing us with some more insight on the modeling and the preparedness of our local healthcare facilities. I think that really will help us as we consider as a health board what recommendation we will make to the full city commission this upcoming Monday as far as what we need to do with our ordinance after May 1st.
And you're welcome, gentlemen, to stay on the call if you'd like. We're going to discuss that recommendation. You're more than welcome to participate, but I know you're very busy as well. So certainly sign off if you'd like.
I'll probably go ahead and drop off. Thank you, folks.
One more question, Dr. Basil.
Yes.
Yeah,
Are you okay with sharing your presentation?
I just want to echo a thank you. So I just wanted to echo also a thank you to that. That was very, very helpful.
Are you okay sharing that presentation with us, Dr. Basil? Could you send that to the city manager?
What I might do is, if you've got until next Monday, I might even wait a couple days to see if I get some more specific I,
couldn't hear you, but maybe that's just me.
No, Nathan, I lost him too. This is Doug, and I think what he was alluding to is if he could wait a few days, we may have some more data that would be more specific to the Yankton market, if that would be helpful.
That would be wonderful and very much appreciated by our staff and the city commission as well.
I'll be in touch with the doctor and we'll see what we can get closer to our meeting date.
Okay, sounds good. Thank you, and thank you all for what you're doing as a commission. I know these are not easy decisions.
This is Dr. Basil, and yes, that's exactly what I was saying. A couple more days, I should know more.
Thank you.
Okay, we'll be in touch. Let's continue on with our agenda, and after that presentation, just discuss a little bit, Health Board, what our thoughts are surrounding our recommendation to the City Commission. We certainly can talk about it Thursday as well. However, I need to put a packet piece together, so it'd be helpful to have a sense for where we're headed.
Dr. Milroy, do you want to go first since you're the expert? And I have some opinions, but I would like to hear what you have to say first.
Okay, I have an opinion also, but I would have to say I don't feel like an expert in this. I think we're all learning as we go and kind of a moving target. But I think what I heard from that is that we don't know quite yet. It looks like a lot of I think he said a number of times that some of the more aggressive measures that the city of Yankton put into place are working. I mean, that's success. I think I heard that. I think we should mention that to the city commission when we talk to them, that we've looked at the numbers and we've had an expert come in and talk to us. And I think that some of our efforts have been successful, and we should celebrate that in a way that, this is working. It's rough, but it's working. And it looks like some of the numbers are encouraging. I don't think that some of the peak numbers will be nearly as bad as originally forecast, but that we haven't peaked yet, but by very early May, we should have better indicators. And so I think my recommendation is that we hold tight with our recommendations until early May. So I know we're going to face pressure on that, but I think that is the message I was hearing pretty loudly from the presentation today.
So the ordinance will expire May 1st if the commission doesn't extend it. Are we going to ask for an extension or an amendment? I was thinking prior to hearing this about an amendment, but to me, it looks like we will be end of May before we are really, if we stay on the track that the doctor showed us, that we're really going to know where our peak is. So I guess I'm reevaluating.
I think I would recommend extending it through May, and then hopefully as we look at the predictions, if we think things look better, I mean, that could be shortened. But for now, I would say it looks like May is a good recommendation.
Dr. Milroy, we have certain businesses. I think of the hair salons, the pet groomers, who are really anxious to get back to work, and I know we empathize with them to a great extent. Are there any areas where you think we could let up as long as they're willing to agree to certain measures? That they keep putting forward ideas as to how they think they could practice more safely. I know that's going to be a part of the conversation, and it's something we need to think about.
Yeah, I certainly agree with that, and certainly some of the things like hair salons and dog salons, it's where there is, you know, not large groups, that it could easily be in smaller groups. I would certainly include them in our first phase of relaxation of some of the, you know, I would say things, they would be in a different category than, say, a busy restaurant or a busy bar, where you might have dozens of people. So I think that they are in a different category, and we could certainly look at opening them up earlier. So
I'd like to hear from the
some of the things that they suggested are good.
I'd like to hear from the ex officios. You know, I worry too about if we, you know, if we're opening one business, then do we, you know, where do we stop and start with that as well? But ex officios, what are your thoughts looking at the data?
I'm going to just jump in. I mean, I think the data shows that we need to wait, but I also, I've really been watching Beadle County, and their numbers have not moved. So I made contact with somebody. So 17 days, they haven't had anything, and they have restrictions like we have. So they're on a good path, and I see our numbers. They might maybe not be climbing fast, but there's a couple every couple days. There might be one, or there's another one. I see we're getting some recoveries, but we haven't had a long period of time where we have had no positive cases. And I think that's where we really want to be before we even consider changing or modifying our ordinance or what we're doing.
I guess I would add that based on what I saw this weekend, if any of you were drove up and down Broadway and saw the activity at the businesses, many of them were extremely busy. You know, up on the north end of Broadway, especially, parking lots were full, which makes me believe, after seeing this presentation also, that interaction and those interactions, and a lot of those license plates were from different counties, could lead us to a wealth of knowledge here in about 2 or 3 weeks. So if I was going to make a recommendation at this point in time, I would lean more towards week to week, or maybe 2 weeks sort of idea, rather than an entire month again at this point in time. And then maybe in a week or two, we could reconsider. And I understand that might take a special meeting by the city commission, but based on how active the town was over the weekend, I'm thinking if we're going to see some increase in numbers, that could have facilitated it. So I'll be curious to see what we find out.
You know, I agree with Dave completely there. You know, another part of the challenge when you talk about the service area of a Vera Sacred Heart Hospital is it's certainly true that I think activities and actions taken here have made an impact on that. But they, of course, serve a really large area with not a consistently stringent approach to the situation. So I don't know how much of an effect that will have on the situation as well. If neighboring counties and communities have, again, a really broad spectrum of actions in place and different behaviors, some of those things that we have talked about on the edges, certainly not easing back on large gatherings or those sorts of items, but some of the activities on the periphery and some businesses who may, from the coast, be coming up with best practices and procedures to do those things, it may or may not have a large difference on what that curve is going to look like if the service area hasn't adopted widely consistent limitations. Maybe it makes sense to look at what week to week, what industries in other parts of the country are doing to come back online partially, at least.
Yeah, with the with the parks still open, and as the weather gets nicer, I think we will continue to see that influx of people from other parts of the region. And if you look at the news, there are other hotspots. Outside of Sioux Falls, Grand Island is also experiencing a real growth in cases in Nebraska. Lexington in Nebraska is also seeing an increase. So cases, we are seeing hotspots around us, and those cases can grow really fast once they get started. And so there is that danger in letting up too much too soon. Unfortunately, people are just getting a lot of mixed messages out there from, especially at the national level. And it just makes it hard for those of us at this level of government who are trying to do the best we can for the people that we have control over and want to help and make sure our healthcare system is able to care for them if they need it. That is the major challenge right now. So I do like the idea of going by more of a week or 2-week basis, so people feel we are being very responsive to whatever we see evolve. And if we do luck out and cases aren't materializing at the rate that the model predicts, we can start thinking about loosening things up.
So I've got a couple thoughts. Based on the presentation, the lag time in being able to see the effect of what we've done is about, I believe he said, a 14-day turnaround. And up until about a week ago, we were on a different trajectory, and we were the second behind Sioux Falls in terms of total number of active cases. And starting about last Monday, we started to have recoveries surpass new active cases, which leads me to believe that what we have done has had a measurable effect based on that time frame. What my sense of it is I think in terms of controlling people and trying to prevent them from interacting with each other, I think we've done about as much as we probably need to in terms of keeping people apart. I think this last weekend is a demonstration of how we're our own worst enemies as a collective group. We get stir crazy enough and we make stupid decisions. And I think we will probably see a bump in a couple of weeks from all of the people gathering together outside in various places over the weekend. But I'm not sure at this time. I don't get a sense from anybody else at this point that new or additional regulations are necessary. But I don't think we're in a position to have to recommend more right now.
Yeah, I mean, I'm basically concerned with, the existing ordinance. I'm with you, Ross. I certainly don't think there's a reason right now to take a step further. I'm just wondering, what's the best thing here in terms of extension or I think our recommendation probably isn't going to come out of today's meeting. I think we're going to have to talk about this because every day we have more data, right? Every day we have more information. So probably our recommendation to the commission will come full circle next Monday afternoon after we meet, because we'll have a whole nother week of data to pull from. I mean, if our cases were to jump dramatically, I think we would all take a much stronger stance at where we are. If they continue to drop or stay steady, we might then want to look at a shorter time period or starting our phased plan for reopening. And I know we lost our live stream, and we do have this meeting recorded, so we'll be posting it later. So for the people that are watching it later, we are starting to talk about reopening, and we'll be talking about that with this group as well. Other cities are starting to talk about that as well. But I don't know of anybody that's talking about doing that quite yet. I think we're all in this, let's watch and wait and see. So we may have to keep talking. We'll have more information on Thursday than we do today, and certainly next Monday than we do right now. So to me, even the difference between, you know, a few days over the weekend can make a big change in where we are on that curve. So that's probably frustrating for people watching, to not know exactly where we're going to go. But I just don't think we could today make that and feel secure about that recommendation.
Amy, do you have other things on the agenda? Otherwise, I would like to bring up, I guess, some concerns I heard over the weekend.
Yes, I do. Just that one of the things that was alluded into the other item, which is a preliminary discussion on reopening, and I want the health board members to know that Ross and I are going to be involved in a call with other city managers and city attorneys from around the state, and we're going to start talking about reopening practices, I guess. Not that we're all going to look the same, but sort of standard operating practices. We don't want to make this health board or the city commission have to write an ordinance on their own. So we're going to start talking about those things. Also, I wanted to let the public know that we are moving ahead with the election on June 2nd, and absentee voting is available. And I did hear today that the county does have ballots available now. So you should be receiving at home, if you're a registered voter in Yankton County, some information from the Secretary of State that will be instructions on how you can do a mail-in voting process. So if people can follow that application and move forward through that, you can vote, of course, in the city commission election if you're a city resident, and all county residents that are registered can participate in the county primaries if your party's having your primary. So that's available. Absentee voting is also available at the county building. So folks can contact the county offices for more information on that if they want to go physically to vote. And when we do conduct the election, we're looking at methodology so that we can keep people as distant from each other as possible, making sure we have equipment for our election workers and make sure we have washing stations and things like that for folks that vote. So I just wanted to bring forward those things. And we could talk about those more as the time progresses as well. But Mayor, if you want to bring up what you heard over the weekend.
Amy, sorry, this is Brad. Just one, everything you said is absolutely right. The one thing I think I would emphasize that I read in what the county sent out is they're really encouraging you, if you're able to use that mail ballot, to not try to make an appointment and vote at the county government center. If there's at all a way you can participate in the mail-in process, just a strong encouragement and request from them to do the mail-in version.
Thanks for that, Brad. So the concern I heard over the weekend from several people is about, can everyone hear me okay? Okay. Regarding masks in businesses, in some businesses, we are seeing employees wear masks, and others we are not. That may be retail, it may be manufacturing, and I know it's just a CDC recommendation at this point, and we are encouraging people to follow the CDC recommendation when they are in public places. Just wondering if it's worth having a conversation with businesses or doing some education around that. And it may be an issue if they can't get their hands on cloth masks, and cloth masks definitely don't stop the spread, but I think there is some evidence that it helps mitigate it. So I don't know if anyone else has heard that and if they have thoughts on it. It's just a concern I heard from several people who contacted me over the weekend, so I thought I would bring it to this board.
We had a comment as well on Friday about employees wearing face coverings in businesses that are still open. We are recommending that folks do that. And some of our places of business are. I got takeout this weekend at a local restaurant, and the workers, folks that were working there and handing the food over, were gloved and masked, and many of the people coming in also were gloved and masked. So we encourage that. There is, I did hear from a business that also said they want to have face coverings. They just haven't been able to get a hold of them yet. So that could be an issue too. They may not have someone who has been able to make them or be able to secure them. So we're still trying to get education out from folks on things they can use if they don't have them available. But that could be part of the issue too. So we are aware of that. I don't think we, have the ability, nor do we want to start, moving about and trying to get folks to be wearing them. But I have seen a lot of people who are just choosing to do that as well. So.
I think the part about the mask was an advisory, so I don't think it really had enforcement behind it. And I think we can continue to strongly encourage it, but it was still an advisory. Also, there are a number of places in town where people can get masks. In fact, I was just on a call earlier today, and Sandy Hoffner, for one person, mentioned that she has a basket of them, that she's had a number of people come and stop and get them, and that she and I think a number of the quilters and other people are providing some. So if people are looking for masks in town, they should be available. I think there's a number of people making them. So I think that's one person also would be a good contact person that hopefully they could obtain. I mean, she said that she actually has a basket, and I think there's been 20 organizations or so that, including HSC, the hospital, the prison, and a number of others that have received masks from her and her group. So I think they're there. I think maybe people are just having trouble getting connected, but I think we should continue to encourage that.
That was going to be my question. Is there a way that we as a city could facilitate connecting those who need masks with those who make masks? I don't know if there's maybe some way we could put up contact information if the people who make them are willing to allow that to be put up maybe on the city's website or something.
We can look for a partner to help us do that. I think there's maybe some partners out there that could help us connect those people, so we can reach out to those folks. Other items that people want to bring forward?
I'd just say for our viewing audience, those of you who are out there following the recommendations, following the ordinance, we really do appreciate it. And we know as the weather becomes nicer, it becomes even more difficult. This would have been easier probably in a sense if it had happened in February versus April and May, but this is where we're at. So just thank you to everyone who's helping us out on this.
So before we adjourn, I want to remind the health board that we have another guest coming on Thursday to our health board meeting. We have an epidemiologist from South Dakota State University who is studying our local numbers. We're sending her numbers. Colleen is sending her numbers every day. And so she should have some good information for us as well. I think that's helpful. And also, I think it's nice to be live streaming, but we've experienced enough issues with our live stream. I think what I'll do is I'll have our IT people video our meeting and then just post the meeting right away when we're finished. That'll do two things for us. They can make sure they get the continuous meeting and watch it start to finish. Also, it'll avoid us having to break or be interrupted. So I think, appreciate all our IT is doing for our technology, and it's nice to have it live. It's just too touchy, I guess, sometimes, and I think it'd be better for the sake of the viewer just to watch it right when we're finished. And we'll do our best to post it right away. Folks can always ask us questions ahead of time. They can email the city or email or call me personally and get the questions, and I can get them out to you guys beforehand as well. So folks can certainly participate that way. This is not one of those meetings that's covered under South Dakota open meetings law. So we're doing our best to be transparent and be open, but it is a work meeting. So it isn't one of those where we need to ask comment and all those types of things, but we certainly want to be as open to the public as possible. And I don't know if anyone else gets these, but during our meeting, I get lots of texts and questions. And so I do try to keep up with those as we're chatting. Okay, if I don't hear anything else from either the members of the ex officios, then I'll ask Dr. Milroy and Mayor Johnson to do their job here.
I will make a motion that we adjourn.
I'll second that.
Okay, all in favor signify by saying aye. Aye.
Aye.
Aye.
Opposed, same sign. Hearing none, we will adjourn at 3:11 p.m. and we will speak with you all on Thursday, if not before.
Take care, everyone.
Very good. All right, take care. Bye.